This past Saturday, Eaton Apothecary held a medication disposal drive at their Wellesley branch.
We're sorting out medications that people don't use any longer. They've either expired or it's medications they're no longer taking. We're also taking veterinary products that people no longer use for their animals, over-the-counter drugs, and instead of people flushing them down their toilets or throwing it into their waste cans, we're setting the products up so that way it's incinerated at a facility, and it cuts down on any medications or over-the-counter items that get into the drinking water, which can affect humans, animals, etc., and the environment. So we're trying to do our part in taking care of that. And at work every day I have customers coming in saying, what can I do with my expired medicines that I no longer take? And we didn't really have an answer. And I read an article in a journal a couple months ago, and a few states are working on doing the same project that we are. So we're hoping it gets people thinking that there's other ways of dealing with their medications, because it's too easy just to throw it in your toilet. So we're trying to get this going down the road too. This counter here is where people drop off their prescription bags of medications, and then we sort out the medications based on whether it's a controlled substance or a non-controlled substance. Table back here is for the controlled substances. Controlled substances are things that are highly abused medications or medications that are used for pain, and they're classified in terms of their abuse potential, and those we separate, and they all have to be hand counted. And non-controlled substances would be like high blood pressure medicines or medicines people use for thyroid conditions, so they're not abuseful medications. Table back here, when they're busy, is for non-controlled substances. And then everything is hand counted, and then it's sent over to Lynn, where she documents everything into the computer system.
It's been going great. We've had a lot of people coming by. Some people have been bringing in big shopping bags full of medications, so we've been getting lots of medications coming in. It's been great. One of the things that we advertised was that people could bring their old mercury thermometers, that we would have them disposed of properly. So what we have here are some digital thermometers to replace the mercury ones if people still happen to have them in their households. We also have coupons and information about our stores as well.
41 people came to the event disposing 31 gallons of medications, which included mercury products, recalled medications, pain meds, and blood thinners, among others. Clearly, these types of medication pose an additional risk to patients if inadvertently exposed, as well as a threat to the environment. Reporting for Wellesley This Week, I'm Brian J. Albertson.